Welcome to Microbiology Students. Today we are discussing how to score maximum marks in paper 2. Majority of the students, they feel the paper 1 is easy to crack and write and get enough marks, and it's easy to pass from the paper 1, but it's difficult from the paper 2. Because paper 2 is based on the system-based approach to the microbiology. It's a systemic microbiology. So you have to understand individual system. You cannot just keep on memorizing individual organism in the alphabetical order or in taxonomic order. What you have to understand here is which are the organism associated with which clinical manifestation and the proper system, and based on that you have to identify the disease and you have to write the approach. So basically whenever you have to explain any microorganism, first of all the disease has to be followed with what is the causative organism of that particular disease, what is morphology, which are the virulence factor of that particular organism, the pathogenesis, clinical manifestation, laboratory diagnosis, treatment, prevention and vaccine, among which the most frequently asked one is the laboratory diagnosis as well as the pathogenesis. The laboratory diagnosis of any infective etiology, how to write in your theory exam or how to remember it, that is already we have prepared one lecture on the laboratory diagnosis of infectious disease, how to write in any laboratory diagnosis. Please go and check this video. Now let's understand what are the various systems. So you have a central nervous system, CVS, GIT, urogenital, hepatobiliary, skin, soft tissue, respiratory. Apart from all this system, you have also need to learn about the three more important things are torch infection, oncogenic viruses and clinical mycology. Now clinical mycology we are going to discuss in a while, but here I want to emphasize you on that clinical mycology is the part from which generally 15 marks of questions, 10 to 15 marks question would come, and there are only 5 to 6 topics are there which you have to learn and remember. So it's easy to get this 10 to 15 marks by reading only these topics. So I always encourage to go through all these three torch, oncogenic viruses and clinical mycology, because these are frequently asked questions, and when you can learn only 6 to 7 questions and you can get around 15 to 20 marks, it's definitely you should go with learning these points and the topics. Now let's discuss the various system wise what you have to learn. In CVS and bloodstream infection, the bloodstream infection, how to send the blood culture, what are the clinical manifestation, how to process, everything is mentioned. Infective endocarditis and rheumatic fever. The key pathogens that is frequently asked are HIV, malaria, dengue, candidemia, leishmaniasis. For respiratory tract infection, you have to learn tuberculosis, diphtheria, influenza, COVID, and in fungus, that is aspergillosis, orbitocerebral mucormycosis. See, your mycology topics has started appearing. Here candidemia and here aspergillus and zygomycosis. Now, among this, the majority time, the full question comes from HIV, malaria and tuberculosis, and even sometimes with the COVID. Please, I request all the students to watch the full video, because at the end I am giving you the blueprint, the most 10 important topics that you have to follow to pass in the second paper. So GIT, there will be questions related with bacillary dysentery, cholera, food poisoning, amoebic dysentery or MBBS, giardia, nematode and cystole. Among all these, understand the cholera, food poisoning, these all are amoebiasis mainly asked as a short note or in a case-based scenario. In hepatobiliary, viral hepatitis and hydatid cyst. Understand in viral hepatitis, this would come as a short note as a case base or even as a long case. So in your viral hepatitis, you need to remember this type of table in which the classification, because whenever it comes on a 10 marks question, definitely the first 2 marks is of the classification of the hepatitis virus, and sometimes even 3 marks. So when you write all this thing, the mode of transmission, its genome and the chronicity and the key serological markers, the majority of the thing you have easily covered and understand. And even the viral hepatitis are frequently asked in your table vivas when we are asking the serological reaction with the HBS AG cards. So the viva goes in that, and even with the needle stick injuries. Even you should know what are the percentage of transmission of hepatitis B, hepatitis C and HIV with NSI. Okay. Now regarding skin and soft tissue infection, the main one asked is the gas gangrene and Staphylococcus aureus and Streptococcus pyogenes, pathogenicity and the virulence factor. Gas gangrene, already we have some of the videos I have already uploaded regarding the rapid revision. It's not just a rapid revision, it is for second MBBS. We just want only this much amount from your side. So please go through all these videos, understand how the questions would come and how you can crack the quiz. And in case of fungal, dermatophyte. So in skin, we have discussed the gas gangrene, dermatophyte and virulence factors and pathogenicity of the Staph aureus and Streptococcus pyogenes. Staph aureus associated with abscess, Streptococcus pyogenes with cellulitis, diffuse lesion. In case of CNS, the meningitis would majority time comes as a 10 marks question. The short note would be a neurocysticercosis, rabies. In rabies, majority time it comes as the vaccines that is related with the rabies or the post-exposure prophylaxis with the rabies, because everyone should know what you should do when there is a dog bite. Even poliomyelitis is very important, and in poliomyelitis the vaccine part is very important. Even this can be asked as a case-based scenario. And tetanus. Now in urogenital tract infection, the important topics are gonorrhea. See, people learn only gonorrhea. You don't focus on non-gonococcal urethritis, but that is one of the frequently asked short note. It's very easy to remember. Only you have to understand the etiological agent and then the laboratory diagnostic test. The most important one is syphilis. Syphilis can be asked as a case-based scenario as well as the long question or even the short note. The syphilis you also get frequently asked in your table viva. So I must say you should not leave a syphilis one. The congenital infection, at least if you cannot read the full one, you should know what is torch and their full form and some laboratory investigation that is associated with that. Ideally, you have to also know the various triads that is associated with like cytomegalovirus, rubella syndrome, congenital rubella syndrome, everything. But at least remember this thing, so you can get at least 2 marks. Now on oncogenic viruses, here also I want to emphasize, if you don't able to remember the full short note, at least remember the etiological agents related with the oncogenic potential, like which are the oncogenic viruses. Even sometimes they will be asked as oncogenic microorganism, but basically this is related with the postgraduate, so generally not asked. In clinical microbiology, now these are the important questions that you must know, and these are Candida, dermatophyte infection, cryptococcal meningitis, aspergillosis and zygomycosis. You should know all these questions. This can become as a case based or as a short note. Majority time it's a short note. Now as promised, this is the final revision. So we have divided the list of the topics in a 3 category. Priority 1, that is non-negotiable. You must read this and you must learn this and you must able to write this. Without that you cannot pass. If you don't remember this, if you are not able to prepare this one, you cannot pass. So in that the tuberculosis, HIV I have mentioned twice. Why? It is very important. You should know starting from the morphology, its In HIV, the majority will be asked, is there morphology? So you have to know how to draw the HIV, the virus, the diagram of it. Even the NACOD strategy is very important. In laboratory diagnosis, students, you generally mention antigen detection, antibody and molecular. No, you need to understand everything in depth. What is Western blot assay, when it is recommended, what is NACOD strategy, then and then you will get mark. I'll say you remember HIV, because if you prepare it thoroughly, you can get at least 9 marks out of 10 from the HIV. Similarly, in case of tuberculosis, that we have already discussed in depth in 2 lectures in our micromed education rapid revision series, because this is also frequently asked in 10 marks questions or even a case wise. Understand, student, these are the topic definitely will be asked in your paper. Viral hepatitis, cholera. Among this, many of the cases we have already discussed in our rapid revision. The rest will be released soon. So I'll request you to please go through that video and understand. Cholera, amoebiasis, gas gangrene, meningitis, rabies, syphilis and dengue. Now the priority 2, you have food poisoning, giardiasis, infective endocarditis, candidemia, dermatophyte infection, aspergillosis, influenza, COVID-19, gonorrhea and leishmaniasis. And in priority 3, the hydrated cyst. In hydrated cyst, you should know how to draw the cyst, because this will be asked and you should write. Even in 2 marks sometimes they ask draw the diagram of hydrated cyst. Rheumatic fever, neurocystic sarcosis, poliomyelitis, non-gonococcal urethritis, congenital infection and oncogenic viruses. Now regarding how to write. So whenever you have to write, we have already discussed the blueprint, that is the clinic, the organism, its virulence factor, morphology, all these things you have to do this subheading and write the answer in 10 marks, or whatever has been asked with the mark system that will be mentioned. So the structured question has to be answered in the question that which will be asked. You have to understand, you have to draw the diagram, you have to write in a point-wise manner, use a mind map, flow charts, step-by-step flow charts, diagram, and even if possible, if the differentiating point is there, that you should write in a tabular format. Understand, student, these are the topics that are high yield topics. I know you should work very hard to read this, but even though if you want to start your journey even in the late after your prelim examinations also, it's not, still you can easily pass if you follow these high yield topics. Understand the organism's pathogenesis, do not try to memorize it, use the all frequently asked topic, prepare accordingly, revise the topic with the rapid revision and write the legible answer. Stay tuned with Micromed Education Student for more updates and more learning, and please recommend this to all your friends and colleagues from the same university, different university, and help us grow. Thank you.